Hey, Happy New Year. Welcome back. Today we're going to be discussing an important topic, which is a side effect of chemotherapy, which is hearing loss. So, over the past year, it seems like I've kind of noticed a little bit of it seems like my hearing has gotten a little muffled. The occasional tinnitus popping up, the ringing in the ears, if you don't know what that is. Um, and I've kind of started noticing that lately. And so I was speaking to my oncologist earlier this past week about it, and she said it very well could be part of chemotherapy and radiation therapy as well. So that was kind of a surprise to me that both of those could have an effect on your hearing. So I wanted to explore a little bit about that. So there's two primary types of hearing loss. One is conductive and one is sensorineural. Yes. Conductive hearing loss occurs due to problems with the ear canal, the eardrum, or the middle ear, like it's blocked with water, or blocked with earwax, a ruptured eardrum, or a damaged eardrum. Kind of more of like something like that. So, and then you've got sensorineural. I have a really hard time saying that. Sensorineural hearing loss is commonly caused by damage to the delicate hair cells, which are inside the ear or inside the inner ear, or the nerve pathways that transmit sound to the brain. Um, and which one does chemotherapy affect? Well, chemotherapy drugs affect the sensorineural more than the others. So, chemotherapy drugs are designed to target and kill rapidly dividing cancer cells. However, they can also damage healthy cells, including the hair cells responsible for transmitting sound signals to the brain and the nerve cells. So, certain chemotherapy agents, such as cisplatin, carboplatin, and I think the third one, vincristine, are known to have ototoxic properties, means they can harm the auditory system. So, to the extent and the severity of hearing loss, that can vary depending on the specific drug, the dosage, and your individual susceptibility. So just because you're getting chemotherapy doesn't mean you're going to go deaf. All right. So what are some of the symptoms and the diagnosis of chemotherapy-induced hearing loss? So some of the symptoms might be difficulty understanding speech. People begin to speak or sound muffled, or their volume isn't as high as it used to be. You may have tinnitus, which is a ringing or buzzing in the ears, or a feeling of fullness in the ears, like that feeling when you get water in your ears. That's kind of that same that can be that same feeling. Um, Diagnosing chemotherapy induced hearing loss usually will involve a trip to an audiologist, and they're going to utilize several tests to determine the type and degree of hearing loss, such as a pure tone audiometry or speech audiometry. So, how am I going to manage that if I start having some hearing loss, like I'm talking about? So, communication. Inform your loved ones and your friends that you may be having some difficulty hearing from the chemotherapy. Ask them to speak clearly and face you when talking. So I'm going to turn the microphone around. This particular microphone is designed to speak from this side. So if I talk from here, it's a lot more quiet. However, if I turn it back, it becomes louder and a lot more clear. Hope those noises weren't bad. So um, ask them to speak to your face when talking. You can understand it. You can actually, believe it or not, you can lip read pretty well. Um, and then also maybe look at something assistive listening devices, which are like hearing aids or other devices to amplify the sound and improve communication. Um, Environmental modifications. So reduce background noise by using carpeting, curtains, or other sound absorbing materials in your living space. Nothing's worse than, even if your hearing is 100% there, nothing's worse than being in a room and trying to listen to somebody where the sound is just echo, 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 echo. It's hard to listen to. And then, of course, there's some things with support groups. Joining support groups, online communities can provide just the emotional support and even tips on how to deal with some sort of hearing loss and how to improve your survivorship and your lifestyle. you really need to talk to these folks before, during, and after your treatment. Find out what it is that you're actually getting. What kind of drug are you going to be taking? What are the side effects? What are the worst side effects you can expect? What are the middle of the road side effects? And what are the most mild side effects? Give yourself that broad range. And that gives you an idea of what to expect. So when you notice something or it starts coming on, it's not like, holy cow, what is this? All right. So all is not without hope, though. There are studies going on right now that are exploring ways to reduce the effects of chemotherapy drugs on hearing. And believe it or not, once again, old drug, new job. It's a drug called, you may have heard of this, called auditory. I can't remember how to say this. I got to say it. Hold on.
Atorvastatin.
Atorvastatin. Now I got it. Okay. So atorvastatin. You may have heard of that. You may have heard of it called under its other name, Lipitor. Using that, there's now a phase 3 study going on to determine if that does, in fact, based on some previous research, if it does, in fact, help reduce the effects of chemotherapy on hearing. And other studies are currently getting started regarding cell generation and reprogramming. That's going on at Harvard Stem Cell Institute, and I think that's pretty much in the infancy stage right now. Very complicated, some very complicated studies, but it seems like they are slowly moving forward with that. So brings us to the end. Remember, like, share, subscribe, and above all, please leave me a comment down there. Tell me where you are. Let me know. Have you had some hearing loss? Are you suffering from hearing loss? Family members, and how you're dealing with it. Anyway, until next time, see ya.